Many years ago, about 8 years ago, there was this wonderful patient called Evgeny. Usually, we always admit patients to hospital on the day of the operation and operate straight after admission. But he was in such a serious condition that we had to admit him the evening before to prepare him for surgery. He suffered from severe abdominal obesity, meaning everything was inside his belly. He had a huge, enormous belly. He was 36 years old. And when he came out of the lift, his belly would come out first, and only then would Evgeny appear. So that evening, as I was leaving work, I decided to pop in just to see what he was up to, whether everything was all right with him, and if he was mentally prepared for the operation. And when I entered the ward, he was sitting there, crying. And it struck me so much, because when a woman cries, we see it very often. We have many patients who cry, and of course we comfort them all, but women's tears don't move you in the same way as when you see a man truly crying. I simply can't remain calm when that happens. Naturally, I started to comfort him and asked what had happened. I asked, "Are you so afraid of the operation?" He said, "No, not at all. I'm ready to sign any document right now stating that the doctors bear no responsibility if I die on the operating table. That would be salvation and a blessing from God for me. I've reached such a state in life that I no longer want to live." I asked, "Then why are you sobbing?" He said, "Well, I have a rather peculiar life." I said, "What's wrong with it?" He said, "I have a wonderful family. I have a wife. I have 2 boys, 8 and 10 years old. My life has reached such a point that for the past 2 years they've been telling me openly, 'Dad, please don't come to school. We're embarrassed. They call us names there.'" Really? He said that about 2 weeks before enrolling, there was a friendly match at school between the sons and the fathers. Right, they were playing football. He was specifically asked not to come, so that he wouldn't interfere with the event. He has a very warm relationship with his wife. But since they haven't had a sexual relationship for about 5 years now, they don't want to lose their family or get divorced, because they have children. They sat down like adults, talked things through, and came to the conclusion that since everyone has their own needs in life, the wife could quite calmly take a lover, which is exactly what she did. And for about 2 years now, she hasn't spent the night at home twice a week. He knew that she was going out, that she had a man. And to the children, they explained that she was going on some kind of night shifts. And he, the patient, explained it like this, that the situation had become so psychologically unbearable for him that if something were to happen to him on the operating table, it would simply be a way out of the situation. That's how it was meant to be. Technically, he was a difficult case for us, I must say. We operated on him in 2 stages. We weren't able to do the entire planned procedure at once. First, we performed a sleeve resection, and then, after he lost a certain amount of weight, we did the 2nd stage. He came back very quickly, about 3 months later, straight for the 2nd stage, and we added a bypass operation. And that was it. He went back home. Naturally, there are a lot of patients. We have our usual routine, and everything was forgotten. Thank God, everything was fine with him. There were no complications. And about 6 months later, in the middle of the night at 3 o'clock, the phone rings. Naturally, when a surgeon gets a call at night, what does the surgeon think? The surgeon thinks only one thing, that something catastrophic has happened in the hospital where the operated patients are staying. You have to jump out of bed immediately, get ready, and rush to the hospital. Naturally, the adrenaline kicks in. I wake up, fall out of bed, and start looking for the phone. I frantically answer the call and hear on the other end, "Hello, hello, Natalia Semyonovna, Natalia Semyonovna, it's me, Zhenya, Zhenya." "Which Zhenya?" "It's me, Zhenya." I say, "Yes, Zhenya." He replies to me, "Natalia Semyonovna, it just happened, everything happened for me." I say, "What happened?" "My wife came back, we just had sex. Everything's fine, she came back, do you understand? She came back." I say, "Zhenya, congratulations, but it's 3 o'clock in the morning in Moscow." He says, "I couldn't wait until it was 9 in the morning in Moscow. I wanted to call you right now and tell you." That's the story.